Now we are going to study the femoral triangle of the thigh. The boundaries of the femoral triangle are the laterally the medial border of this sartorius muscle and medial border of this adductor longus muscle will form the boundaries of this femoral triangle, and the base is formed by the inguinal ligament and apex is formed by the joining of these two muscles. It is the apex part, and the roof of the femoral triangle is formed by the skin, superficial fascia and the deep fascia, and the floor is formed by the skin, superficial fascia and deep fascia, and the floor is formed by the three muscles. So you can see this is the pectineus muscle and this is the iliacus muscle, and you can see here this is the fossa major muscle. This is forms the floor of this femoral triangle. And now we are coming to contents of this femoral triangle. Most medially it is femoral vein is most medially, and most laterally is this is the femoral nerve. Most laterally it is femoral nerve, and in between this is femoral artery, and the branches of this femoral artery, it is in the major branch of this femoral artery within the femoral triangle is this is the profundus femoral artery. You can see this is the profunda femoral artery, which is a branch of this femoral artery, and again it gives the another two branches, which is this is the lateral circumflex femoral artery. You can see which is separating the anterior and posterior divisions of this femoral nerve. It is the lateral circumflex femoral artery, and this is the medial circumflex femoral artery, and again this lateral circumflex femoral artery giving another three branches. One is ascending branch and transverse branch and descending branch, and another continuation of this profunda femoris artery is this is the continuation of profunda femoris artery. It gives the another perforating branches and muscular branches in next part. If this is, and now this is the femoral nerve. It is dividing into, this is the anterior branch and this is the posterior branch. These two branches are separated by the lateral circumflex femoral artery, which is a branch of profundus femoris, and you can see the anterior branch is dividing into another two branches. This is the thickest nerve, which is nerve to vastus medius muscle, and this is the saphenous nerve, which is accompanied by this saphenous vein, and this is the posterior branch of this femoral nerve, and it is going to the posterior compartment of this thigh. And the femoral vein gives the one branch, that is this is the profundus vein in the thigh in the femoral triangle, and this is the saphenous vein, which is not the part of this femoral triangle. The clinical aspect of this femoral triangle is the femoral hernia. The femoral hernia means the abdominal contents like intestinal, small intestine will extend to the femoral triangle behind this inguinal ligament, that is called a femoral hernia. This femoral hernia first goes to the downwards in behind the inguinal ligaments and come forwards in this behind the linguinal ligament and comes upwards in this femoral triangle, like it's like a bulged part in the femoral triangle. For this correction of the femoral hernia, we have to follow the reverse pathway.